Hello, I'm Dr. Hoon Bae-jeon, transplant surgeon and the surgical director of the liver transplant program at UI Health. Our group has 5 highly experienced liver transplant surgeons, and as one of the most experienced living donor liver transplant programs in the country, we'd like to introduce how we are doing with living donor liver transplantation. Thank you for your interest and also consideration for becoming possible living donor for liver transplantation. Thank you.
Hi, I'm Lisa Mariano. I'm the liver transplant nurse coordinator, and I sincerely look forward to participating in your care as we work toward your potential living-related liver donation. I will be coordinating your testing and communicating your results and working in conjunction with Dr. Jian and the transplant surgeons, and together we look forward to taking care of you. The purpose of this video is to introduce you to the process of living-related liver donation. Common questions will be answered so that by the end of this educational session, you'll have the information necessary to help you make a choice regarding donation. Thank you for your interest in becoming a potential donor. Patients who are on the liver transplant waiting list are in need of a life-saving liver transplant. Unlike other organ wait lists, patients on the liver wait list are prioritized according to how sick they are and not to how long they have been waiting. Using a nationally standardized scoring system, patients on the liver transplant wait list are ranked by a number anywhere from 6 to 40. This number is derived from a combination of 3 lab values obtained from blood work. This score is called a MELD score. MELD stands for medical end-stage liver disease. The higher the number and the closer the score to 40, the sicker the patient is, and the closer to potentially getting a liver from a cadaveric donor. Unfortunately, oftentimes a cadaveric donor does not become available, and our recipient either becomes too ill to get the transplant, or in some cases, may die waiting for a liver. The medical team is always trying to control 2 variables, 2 moving targets with the cadaveric donation process. One target is the recipient's condition, which is ever-changing. We do our best to optimize the recipient's condition and to keep our patients well enough to undergo transplantation. The other moving target, of which we have no control, is the timing and availability of when a cadaver donor becomes available. With living donation, however, the medical team is able to optimize the recipient's condition as much as possible and control the timing of the liver transplant. This control makes a huge difference for the recipient and their overall prognosis and recovery. By gaining control over the timing of the operation, we are better able to ensure a safe outcome for the recipient. We no longer need to wait until our recipient is critically ill with a high MELD score to be in the running for a cadaveric donor. We now control the timing of the transplant surgery itself, when it's optimum for both the donor and the recipient. This allows for a quicker and safer recovery. The donor's safety is always our first and highest priority, even above the recipient's. Please remember that at any time during the evaluation process, if the donor should change their mind and decide not to proceed, the decision will be supported and kept strictly confidential by the medical team. The team will inform the recipient that the donor was found not to be suitable and will not be given any further information. Privacy and confidentiality is also our highest priority. A series of tests will be completed in order to ensure that the donor is completely medically healthy and able to sustain the stress of liver donation. First, a blood test will be done to see if the donor is a compatible blood type match to the recipient. If a match is determined, other tests will be completed to ensure the donor's suitability. We are all born with more liver tissue than is needed to sustain in healthy adults. The liver is able to regenerate itself quickly, allowing for successful surgical removal of just about 60%. In normal healthy adults, the remaining liver will regenerate and grow back full size within a very short time. After undergoing a liver biopsy, the medical team will determine how much fat is in the liver. This is very important to assess. If the liver is too fatty, it will not be able to regenerate and the potential donor will not be a candidate. After all of the testing is completed, the donor is then cleared for surgery. The surgery will be arranged at a mutually convenient time for the donor, the recipient, and the surgical team. 2 complete OR teams will need to be available, as both donor and recipient go to the operating room at the same time, in coordination with each other. The operation itself for the donor can take a few hours, and the overall recovery and time in the hospital varies between 4 to 7 days. Postoperatively, the donor recovers in our transplant ICU. All efforts will be made to keep pain under control, and in most cases, the donor is up and walking the very next day. It will take just up to about 4 to 6 weeks for complete recovery, and during this time, many of our donors actually return to work. In most cases, our donors are back to their regular routines in a few short weeks. Long-term follow-up for the donor occurs at 1 month post-donation, at the 1-year mark, and lastly, at the 2-year anniversary. Follow-up visits are with the doctor and include basic labs and a follow-up CT scan. All of the precautions taken before donation, our donors go on to live normal, healthy, and productive lives. Living donation is a tremendous gift and provides the recipient with a new chance at life. On behalf of our team here at UI Health, I sincerely thank you for your interest in considering living liver donation. Should you have any questions, any member of our team will be able to assist you. The journey to liver transplantation is often long and complicated. We look forward to working with you and to help you along your journey of giving the most amazing gift of all, the gift of life.